Good morning. I'm Dr. Ann Brayer, and I'm the director of the Injury-Free Coalition for Kids of Rochester. I'm going to talk to you for a few minutes about choosing safe toys to keep kids injury-free through the holidays. You might not know this, but injuries are the leading cause of death and disability of children in the Rochester area and across the country. So we'd like to do everything we can to prevent injuries, which is what our organization is all about. I'm going to start with just a few basics. When you're choosing a toy, pay attention to the suggested age range on the packaging. You might think that this is based on factors such as maturity or intelligence, but actually they base these ages on what's safe for children. The kind of injuries that we're talking about include choking, strangulation, falling from an object and injuring yourself that way, possibility of toxic ingestions, and also of injury to the eye with pointed objects. So those are all kinds of things that we're going to try to avoid. Starting first with the youngest children, the infants and toddlers. Here, the risk of choking is the greatest. And to prevent choking, we want to choose toys that don't contain small parts. And you can see the image there of what's called a small part tester or a choke tube. And that is something that is 3 centimeters by 6 centimeters. If an object fits completely in the choke tube, which is roughly the size of a toilet paper roll, it's probably too small for the child to be playing with. You can pick one of these up at any toy store, or like I said, you can use a toilet paper roll as an estimate of what's too small for children. And you also want to avoid toys that have any small parts attached that are easy to pull off, such as stuffed animals with glued on eyes or ribbons and small things like that that can be taken off of the toy by the child. You want to avoid toys that have strings longer than 7 inches, because 7 inches or less, it would be nearly impossible for the child to cause strangulation. But once you get over 7 inches, the risk goes up. You may be familiar with the fact that we've removed drawstrings from children's clothing, and that's for the same reason. Stuffed toys, when you choose them, I already mentioned they shouldn't have small parts that are able to be pulled off, but they should also be washable because it's inevitable that they're going to get stained and dirty. And so you want them to be obviously washable and made with non-toxic substances. They also need to be strong enough because children in this age range are mouthing toys all the time. So you want to make sure that they are strong enough to withstand the chewing activity. One thing to note is that the toys that you buy from a commercial source, such as the internet or through a local toy store, all are required to meet certain safety standards. But toys that are given out at carnivals or fairs or vending machines of various sorts do not need to meet those criteria. So you want to avoid those, especially with the younger children. Moving on to the school-age children, here we get more variety in the type of toys that kids are interested in. One thing to note is that any kind of art supplies, including crayons and paints, should be regulated for toxicity. And you can look for that code there, the ASTMD 4236. If that's on the package, that means it's been tested and has been shown to be non-toxic. Anytime, if you're really interested in buying a toy gun, please make sure that it doesn't look anything like a real gun. And please make sure that it doesn't have projectiles in it that can be that can injure eyes, especially in the younger children. So those dart guns should contain soft darts or darts with suction cups on the end, nothing pointed. And then as far as electric toys, they should be noted. You should note the UL signature on the packaging, which means that they have met the safety standards of the underwriters' laboratories, meaning electrical injury is unlikely. Of course, in this age range, wheeled sports gear is really popular. And anytime you're gifting a child any object with wheels on it that they're intending to ride on, make sure that you also give them a helmet and encourage them to wear it every time. This would, of course, include bicycles, but also skateboards and scooters and inline skates. Keep in mind that if you go biking with your child and you don't wear a helmet, chances are they're not going to want to wear their helmet either. So set a good example anytime you can. Helmets are certified by the SNEL organization or by the Consumer Product Safety Commission, and you can look for that certification on the helmet packaging. I also want to mention, because winter is upon us, that you should think strongly about using helmets when kids are involved in winter sports, such as, of course, skiing, but also ice skating and sledding, because head injuries are common in those sports. And you can purchase fairly inexpensively a winter helmet that will take care of that risk. I do have to mention trampolines, and you may know that the American Academy of Pediatrics does not recommend trampolines for children because they carry a very high risk of serious injury, especially head injuries and cervical spine injuries, which can lead to permanent disability, but also pretty frequently fractured broken bones occur with the use of trampolines. You might think that those safety nets that they promote have a substantial reduction in the risk, but actually that's not true. In terms of serious injuries, most of them happen on the trampoline rather than being thrown from the trampoline. So the safety nets don't prevent those type of injuries. And the younger the child, the higher the risk of injury. And the injury risk is much, much greater if more than one child is on the trampoline at a time. So please, if you are using trampolines with children, make sure that they are supervised at all times, that they know the rules, that they know that it's only one child at a time jumping on the trampoline. And please make sure that you remove any ladders from the area in the case that young children could access the trampoline when they're not being supervised. And then just a few definite no-nos for children under 8. Disc battery ingestion is a real problem in children. You can see that x-ray there with a disc battery that's lodged in the child's esophagus, and that can cause damage in less than an hour's time. So it's really something we try to avoid as much as possible. Most toys that are marketed for children now that contain these disc batteries have a secured area for the battery to be lodged so that it requires a screwdriver to open. But please make sure that no batteries are left lying around. If you replace a battery in an object, make sure you dispose of the battery properly and check any toys that have those batteries that it is a secure compartment for the battery. The next thing on my definite no-no list is those, they were called, when they were first marketed, buckyballs, and they now are marketed with many different names, but they're super strong magnets that come in a set usually. You can see one photo there. They're often brightly colored. Each one is smaller than a pea, but is extremely strong. And if children ingest these, it becomes a problem because they adhere across the intestines and can cause damage to the intestines, requiring a surgical procedure. So these really should not be left around and not be given to children under 8 who are at a higher risk of ingesting them. And then finally, balloons. You probably know that balloons are really not safe for young children because of the risk of aspirating them and blocking their airway with the uninflated pieces. And that's really all I have to say. Please have a very happy holiday season and make sure everybody is safe. Thanks very much.